There are many types of skin cancer that can develop due to abnormal growth of skin cells. Usually these abnormal growth of skin cells are referred as malignant cells and can also be referred as tumors. Because the skin has many skin cells such as squamous cells, basal cells, and melanocytes, there are many types of skin cancer. Skin cancer most commonly is developed usually to overexposure to the sun, but can also be caused by family histories or ethnicity. If you have lighter skin, you are more prone or you're at higher risk to develop skin cancer than those that have a darker skin tone. Basal cells and squamous cells skin cancer are two types of skin cancer that are most common, and usually they appear as flat, firm patches in the skin. Sometimes they are bumpy and sometimes they do itch. There are also red patches that do appear, and some develop as open sores or wart-like growths. There are also types of skin cancer that can develop usually first from a different type of system in the body, and then they continue and attack the skin cells. One of these skin cancers are called lymphoma of the skin, and usually this type of cancer first develops in the immune system and then attacks the cutaneous cells of the skin. There's melanoma is usually one of the serious but least common skin cancers, but most of all these skin cancers are treatable, usually by surgical procedures to remove the malignant cells, or you can also use chemotherapy or radiation therapy to be treated to remove these skin cancers. Ways that you can avoid being at higher risk, or you can reduce the risk of getting skin cancer, is usually to avoid overexposure to the sun. Also avoid tanning beds, booths, or tanning lamps that can cause injury to the melanin, which is what gives the pigment of your skin color. Other ways that you can avoid being prone to skin cancer can be, if you have lighter skin, you should wear hats, sunscreens, or longer sleeve shirts. Also, if you've had a family history or individual history of painful, exposed, or much more red sunburns, then you're probably at higher risk and might want to talk to a doctor about those incidents and see if you can develop skin cancer. It's always well recommended to do self-examinations of the full body just to check for abnormalities in the skin.